The biggest thing that I'm looking in the field of my practice is the one that brought me into the field, is trying to help people that suffer from neurological disease and mostly epilepsy. I did a very large participation on clinical trials, so I'm not part of the clinical trial team right now, but I'm always looking at the new compounds that are being used to try to help people with epilepsy. So there are some medications that work on the steroid receptors in the brain that would be a new mechanism of action to attack epilepsy. And then there's a lot of clinical trials of medications that we have available for one of the most common forms of epilepsy or seizure type, which is partial seizures, that are being explored for other syndromes that are more specific, like Lennox-Gastaut, or patients that have specific genetic mutations like CDKL5 or others. So I'm looking at that closely. We have to think about epilepsy as something that affects a lot of Americans. So awareness is very important. We have brought a lot of awareness to breast cancer, which is actually very important. But we lost more people to epilepsy in a year than to breast cancer. Most people are not aware that it's something that had a big impact on society.